Does chronic stress cause diabetes? Today we're going to get into how stress hormones can impact insulin resistance, leading to diabetes, and all the different lifestyle factors that may contribute to insulin resistance and diabetes. So let's get right into it. Stress and sugar, adrenal islet cell axis. Okay, this is talking about how your adrenal glands can impact the pancreas and its insulin production. So, chronic stress response, ongoing glucose demands to deal with high stress. So if you have stress or in stressful moments, what happens is there's more glucose need. So your body will use your glucose stores or glycogen stores, and then it has to go into what we call gluconeogenesis to produce more sugar in order to sustain that high stress moment. So what happens is if you have this prolonged stress, like regular stress, if you have a stressful moment, you have a test, you're stressed, but once the test is over, the stress is gone. But if you have chronic stress, marital stress, things that your child is sick, like prolonged stress, what happens is there's a chronic HPA axis, which is hypothalamic pituitary adrenal axis, activation. So you're activating the cycle of chronic stress related to the brain and the adrenal glands. Okay? So when you stimulate the HPA axis, what happens is you're going to get a bump in cortisol. Cortisol is normal in our body. It's usually higher in the morning when you get up, and then it goes down, and by evening it's low, so you can go to bed. Cortisol is inversely related to melatonin. So melatonin is low in the morning and goes high towards the evening, so you can go to bed. But if you have high stress levels, what happens is cortisol or high levels of cortisol will create insulin resistance. So insulin is not as effective. And in response, your body will increase secretion of insulin from the pancreatic beta cells. So because cortisol makes insulin less effective or less efficient, your body will produce more insulin to try to uptake the sugar into the cell. So that will create a situation where we have hyperinsulinemia, high production of insulin because of stress. Now, chronic stimulation of the hypothalamic pituitary axis will cause insulin activation again. So you have this vicious cycle, and then you have hyperinsulinemia also stimulating the activation of the HPA axis. So you have this vicious loop that cannot be broken unless you change something. The change is really lifestyle. So let's get right into that one. Again, we're talking about stress and sugar, right? What lifestyle factors can contribute to it? People don't realize overtraining can also stress your system. So let's say you're an athlete, you're training 3 times a day, but you're not getting the proper rest. You're overtraining without the rest and your body starts to break down. Or you're a triathlete, training every single day, right? Running long miles, swims, biking. And over time, what happens is because you have a heightened stress response, you will develop issues with insulin resistance. Overworking is also the same thing. Whether it's a physical job or you're working 2 jobs to support your family, long term it's going to impact stress levels, obviously, along with cortisol and then insulin. Lack of sleep. If you have poor sleep over time, it's going to definitely increase your risk for diabetes. So proper sleep is necessary. Psychological stress. Now, we don't talk a lot about what we call PTSD or those types of things. But chronic psychological stress, even from childhood on, right? If you had like a significant childhood event, this can create a lot of psychological stress over time, again, leading to cortisol issues, insulin issues, as well as diabetes. Now, these are long-term effects here. But there are people who miss meals, or what we call hypoglycemics. They have low blood sugar issues. They miss meals, and they have a rapid need for cortisol, insulin, etc. Right? They eat sugary stuff, and they just need that quick fix in order to fix their symptomatology. Also, people who have a lot of excess simple sugars, they also tend to have issues with insulin spikes, cortisol spikes, etc. Right? Now, does athletes need some simple sugar when they're trying to perform? Sure, but there are a lot of people who drink a lot of sugary drinks, caramel lattes, these new things called the boba teas where they put a lot of extra sugar in them. So there's a lot of sugar in the diet, okay? So what's gonna happen? These are all lifestyle triggers, right? If you're really healthy, you get your proper rest, you're resilient, and you're healthy, you will have no symptom changes. You can kind of brush it off and be okay. So it's like you're, 18 years old, right? You worked and then you went out with your friends, you only slept 3 hours, but then the next day you can go out and, work again and go out again the next night, etc. You're relatively young, you're resilient, and you don't seem to really have any symptoms, okay? But over time, especially as we age, we lose stress resiliency. So there's a tipping point. You get stressed over time, and then there's a tipping point. It's like that person who has stressors here, constantly coming. They're handling it well, and then someone honks at them on the highway, and they lose it, right? They just completely lose it because their stress was so high that little bit of stimulus of someone honking at you throws you over the edge. You get angry and irritable, and you kind of lose it, okay? That's stress resilience, right? Your tipping point is very, very low. It's just gonna tip right over if you just put a little more stress onto it. The problem with this is that it creates a lot of health issues. Dysglycemia, we talked about insulin resistance, diabetes, hypoglycemia. So if you lose your stress resilience and you have issues with cortisol, you're gonna have dysglycemia, where there's insulin resistance, pre-diabetes, diabetes, or people who have hypoglycemic ups and downs. It also creates insomnia. Patients don't realize that high blood sugar causes sleep disturbances as well as low blood sugar. For instance, if you have high blood sugar or insulin resistance, you're that individual will have dinner, sit in front of the TV, and literally 5 to 10 minutes later, you're nodding off, okay? You fall asleep for maybe 10, 15 minutes. You get up and you go, oh, I should go to bed, wide awake. Can't fall back asleep. It might take you an hour or two, or you might watch 3 episodes on a Netflix series. So you have issues with sleep as a result of prediabetes or diabetes. Now on the flip side, if you have low blood sugar or hypoglycemia, what happens is you'll sleep okay, you'll fall asleep okay, but around 2 or 3 in the morning, you'll wake up out of a deep sleep because your blood sugar dropped. If your blood sugar drops, cortisol will go up to signal your liver to produce sugar, a process called gluconeogenesis, okay? So when your blood sugar drops, cortisol goes up, tells the liver, hey, I need more sugar. Okay, great, producing more sugar. But that cortisol spike just woke you out of a deep sleep. And now you can't go back to sleep for an hour, 2 hours, or 3 hours. And then you finally get back to sleep and your alarm goes off. And you didn't have a restful night of sleep. And sleep also impacts cortisol. Also, cortisol and blood sugar dysregulation will certainly impact high blood pressure or hypertension. You'll have issues with weight gain or stubborn weight gain where you can't lose it. And then also impacts our immune system. Cortisol at high levels or prolonged cortisol levels that are elevated could start to impact your gut microbiome, impacting how your immune system works, etc. Now, when we look at this, you have to ask yourself, are you overtraining? Are you overworking? Are you lacking sleep? Is there psychological stress? Like some of these things that you need to work out on your own. You need to figure out what are your triggers and fix those triggers. But essentially, you have to remove or reduce some of these impacts in order for you to feel better. Now, everyone is different. Not everyone's going to react the same or as quickly if you have a change in diet, right? Because some people, we could put them on a sugar-free diet for, let's say, a week or two, and they'll lose close to 10 pounds. All of that is really related to water retention. They're losing a lot of water weight. But then some people, you can put them on a clean diet, they can't lose weight. It might be like half a pound in a week. They're like, I'm eating so clean, I don't understand. Well, you got to break that vicious cycle of this adrenal, pituitary adrenal axis where it's impacting insulin. So in order to break that, it takes a little time, a little effort, but it's very important, right? Starts with stress reduction, sleep, exercise, and eating the right foods in order to get you back on the right track. All right, my name is Dr. Jin Sung, where clinical excellence meets excellent results, and we'll see you guys next week on the healthy side. Have an awesome day.